Hey guys!
Hello!
Hi! My name's Olivia.
I'm Stephanie.
And I'm Emily.
And today we're going to be talking about how to protect your teeth and your baby's teeth. Our first topic is going to be about the transmission of bacteria from your mouth to your baby's mouth.
The second topic is going to be touching over the subject of xylitol gum.
And the final topic will be about morning sickness and brushing your teeth.
Oh, important fact.
You know that tooth decay is one of the most common of all diseases, second only to the common cold.
Babies are not born with decay-causing bacteria in their mouths. Instead, they are transmitted through contact of saliva from mothers, caregivers, and other family members.
Tooth decay causes pain, suffering, and disability for millions of Americans each year. But what's even more disturbing is that tooth decay is preventable.
If it is not treated, in extreme and rare cases, tooth decay can even cause death. Infection in an upper back tooth can spread to the sinus behind the eye, from which it can enter the brain and cause death.
Okay, so I'm going to talk about how you can transfer bacteria from your mouth to your baby's mouth, causing them to get cavities. In our mouths, there's a bacteria called Streptococcus mutans. This bacteria is what causes cavities and can also be passed from person to person through the transfer of saliva. So the main thing that we want to understand is that tooth decay or cavities is a bacterial infection that can spread from one person to another. Since the baby's teeth are brand new, they have a higher risk of getting cavities. Only parents with active tooth decay can spread the Streptococcus mutant bacteria through saliva. So essentially, this would be like kissing your baby when you have a bad cold, with Streptococcus mutans being the main bacteria and the primary culprit to what you transfer to your baby that will lead them to having cavities. We want to make sure to avoid transferring our saliva to our babies. Also, I want you guys to keep in mind that it's not only going to affect the baby teeth, but the bacteria is able to stick around and colonize for years, attacking the permanent teeth while they grow older. Some things that we can do to help avoid transferring our saliva to our babies is to make sure you're not sharing any cups, utensils, avoid kissing them on the lips, try kissing them on the cheeks, I know it's hard to resist, avoid blowing the baby's food while it's hot, and don't clean their pacifiers with your own mouth.
Next, we're going to be talking about xylitol and the benefits that you can gain from chewing xylitol gum. A gum that I personally recommend is called Icebreakers because it has the most amount of xylitol. The real advantage to xylitol gum is its ability to help fight dental cavities. Xylitol is an ingredient that when chewed, it's going to stimulate your saliva and produce more saliva so that the enzymes in your saliva will kind of protect your teeth and raise the pH in your saliva, and it will also prevent dental cavities. Chewing xylitol in your third trimester of pregnancy will reduce the chance of passing on the bacteria that causes decay to your newborn child. Regularly chewing a gum with xylitol during pregnancy helped women with a high amount of cavity-causing bacteria avoid passing that bacteria onto their children when the children were checked between 9 to 24 months of age. untreated gum disease have a higher risk of premature delivery, and because no one wants to get a filling, much less while pregnant, this cavity-fighting property of xylitol is especially attractive. Xylitol is considered safe in pregnancy and during breastfeeding, according to the U.S. Food and Drug Administration. The use of xylitol chewing gum in mothers lowered maternal oral bacterial load and reduced transmission of mutant streptococci.
If you're experiencing morning sickness, this tip is for you. Did you know that brushing your teeth immediately after vomiting can cause acid erosion? This is because the contents of our stomach are extremely acidic, with a pH generally ranging from 1.5 to 3.5. A pH of 7.0 is neutral. We want our mouths to get back to this baseline of 7.0 as often as we can to prevent demineralization. Demineralization is what can lead to cavities. Acid erosion causes the enamel, which is the outer part of the tooth, to become weakened.
Dental erosion is a condition where tooth structure is lost due to corrosion, chemical reactions dissolving the hard protective coating of the teeth known as enamel. Common signs and symptoms of dental erosion include tooth sensitivity, tooth discoloration, tooth breakdown, thinning and transparency of the edges of the front teeth, and pitting and cupping on the chewing surfaces of back teeth. The most common cause of dental erosion is the overabundance of acid inside of the mouth. It can be introduced externally by drinking acidic beverages such as soda and fruit juice, and can be introduced internally by medical conditions that introduce stomach acids into the mouth, such as acid reflux or bulimia. Over time, this acid dissolves enamel, exposes the softer inner layer called dentin, making the teeth weaker, more sensitive, and potentially prone to decay. In addition, once the softer dentin is exposed, the pace of the wear can accelerate dramatically. This weakened structure can also increase the likelihood of severe cracks or fractures in your teeth. Excessive tooth erosion causes many oral health complications, including discoloration, unattractive and irregular tooth levels, uncoordinated chewing movements, jagged and sharp tooth edges, tooth pain, and eventual loss of the teeth altogether. There are preventative and corrective treatment options for patients showing signs of erosion. Treatment will vary based on the underlying cause, the severity of the erosion, and the extent of tooth damage, making it critical to work closely with your doctor to proactively treat the issue before more damage occurs.
Demineralization is what leads to cavities. Acid erosion causes the enamel, which is the outer part of the tooth, to become weakened. When the enamel is weakened, it becomes thinner over time. Thin enamel can make your teeth appear more yellow and dull, as well as making them more sensitive. When you brush right after vomiting, you are helping the acid from your stomach to penetrate the tooth structure. When combined with toothpaste, which contains an abrasive, the overall effect on your teeth is detrimental. The abrasive in the toothpaste wears away the enamel faster than normal because the acid has already softened the enamel. When the process is repeated multiple times, the enamel is slowly eroded away, making you susceptible to sensitivity, discoloration, and demineralization, leading to potential cavities. To help prevent these effects, one thing you can do is to avoid brushing immediately after vomiting. Wait for 30 minutes, then brush your teeth. In the meantime, rinse your mouth out instead. Rinsing with water is a great method to help return your pH to that neutral baseline of 7.0. Another solution that will help raise your pH is using a sodium bicarbonate rinse. Sodium bicarbonate is what is in baking soda. Mix together 1 cup of warm water, 1/4 of a teaspoon of baking soda, and 1/8 of a teaspoon of salt. Swish the solution in your mouth in small parts, then spit it all out, and then rinse again with plain water. To get rid of any residual bad taste, try chewing some gum that contains xylitol, like Olivia mentioned earlier.
For more information, go to www.mouthhealthy.org and type pregnancy in the search bar. The first result that comes up, pregnancy and teeth, is a great resource that has all sorts of information you may find useful regarding dental health and pregnancy.
This is an article that has lots of helpful information about dental work and pregnancy. For instance, this article explains that preventative dental cleanings and annual exams during your pregnancy are not only safe for you and your baby, but they are recommended due to the benefit they provide. During pregnancy, your hormone levels change. This change can lead to swollen gums that bleed and are very sensitive. Seeing your dentist regularly during pregnancy is a great idea. This article also talks about other dental work, medications used in dentistry, and x-rays during pregnancy.
Thanks for tuning in today.
We hope that the information we gave you is going to help you and your future babies.
Keep an eye out for our next video to learn about 3 new topics.
Bye!